You know what the number one cause of fatty liver disease is? Are you thinking alcohol, prescription drugs? No, neither of those two. In this video, I'm going to get into the number one cause of fatty liver disease, a very common problem in America and around the world. Now, according to the National Institute of Health, approximately 30% of American adults have liver disease, and many of these patients have non-alcoholic fatty liver disease. In other words, their fatty liver has nothing to do with alcohol consumption. As a matter of fact, in the Western world, the most common cause of a fatty liver is insulin resistance. Now, with non-alcoholic fatty liver disease, there's a buildup of fat in the liver, and there may not be any signs to it at all. You may have some general fatigue, you might get some right upper abdominal discomfort, maybe some digestive symptoms, gas and bloating, constipation, but a lot of people, they don't have symptoms. And when they get screening tests done by their doctor, they have elevated liver enzymes, and then the doctor will do some screening tests, usually an ultrasound of the abdomen and the liver, and there you can see the fatty liver, and that's often how it's diagnosed. So we want to go to the root cause of non-alcoholic fatty liver disease, and the number one cause is insulin resistance. Now, what happens when you consume carbohydrates and you have insulin resistance? You're consuming carbohydrates, usually carbohydrates which are too refined. Your blood sugar levels go up, your glucose levels. Your body responds by increasing the hormone insulin released by your pancreas. And that's good because insulin helps to get the blood sugar into the cells. However, when insulin levels are spiking, when they're elevated too frequently for too long of periods of time, it does lead to the deposition of fat in the liver. And of course, this is where the problem comes. And so, depending what study you look at, 50 to 60, 70% of Americans have insulin resistance. So it's no wonder we're seeing this epidemic of fatty liver disease in America. People are consuming these refined carbohydrates in their diet. Their insulin levels are going up, and they're storing fat, not just in the abdomen and the hips and the rest of the body, but they're storing fat around the liver. And that's very dangerous because over time, you're going to compromise liver function, and that can be very serious. In addition, we know that 50% of the adult population has prediabetes, and perhaps up to 70% of the population has insulin resistance. So these are problems indicating that people are consuming the wrong kinds of carbohydrates, they're not exercising properly, and they're deposing fat into their liver, which is very, very unhealthy. I've been helping patients with nutrition and dietary supplements for over 30 years. If you're looking for doctor-formulated, high-potency, high-quality supplements, go to drstengler.com. Now, the best way to address non-alcoholic fatty liver disease is to consume a diet which has healthy carbohydrates, healthy proteins, and healthy fats. Now, one diet that's been studied is the Mediterranean diet, and the Mediterranean diet has been shown to be very effective in preventing and treating non-alcoholic fatty liver disease. And that's a diet that has quality proteins such as fish, nuts, and seeds, healthy fat sources such as nuts, lots of olive oil, fish. It also is high in fiber with fruits and vegetables. It has nuts and seeds as well. And then healthier carbohydrates, for example, getting the legumes as a carbohydrate and protein source, getting non-processed wheat products. In America, we have patients move over towards the quinoa, buckwheat, and some brown rice instead of traditional breads and pastas are used, which really are just simple sugars in the American diet. And so we know that if you do this type of diet, you can also consume things like green tea extract, which could help with fatty liver disease. Matter of fact, the study showed that when you consume a Mediterranean diet, along with 3 to 4 cups of green tea a day and a plant called mankai, the participants reduced liver fat by an astounding 39% over a period of 18 months. Also for our patients with fatty liver, we like to use supplements. I like to use liver supportive herbs like milk thistle, dandelion root, artichoke extract. I like to use glutathione. Glutathione assists the liver in detoxification, getting rid of the toxins that can build up and are stressing the liver cells. So if you have fatty liver disease or you suspect you have it, you can certainly get tested by your doctor. But if you incorporate a Mediterranean style diet, get that green tea in like I talked about, you could consider using the mankai, as well as some of the supplements, you can be very proactive and improve your fatty liver disease. Well, now you know the number one cause of fatty liver disease in America. It's not alcohol, it's not medications, it is those darn simple carbohydrates, the refined grain products that people are consuming, spiking their blood sugar levels, spiking their insulin levels, and causing fat deposition in the liver. So now you can be proactive. Get on the diet I'm talking about, use some of the supplements, lose weight in a healthy way, and you can find over a period of 12 to 18 months, you can substantially reduce that fatty liver, which will not only make you feel better, but will add years to your life. I hope you like this video. If you want to see more on nutritional medicine and integrative medicine, look for more videos on my YouTube channel.